मिलके चलो लड़ते हैं, चलो पढ़ते हैं, चलो दौड़ते हैं, let's run together, चलो दौड़ते हैं, fight against cancer, चलो दौड़ते हैं, let's run together, चलो दौड़ते हैं, कैंसर को रोके, खुशहाली फैलाए, एक उम्मीद फिर से हर दिल में जगाए, चलो लड़ते हैं, चलो पढ़ते हैं, चलो दौड़ते हैं, let's run together, चलो दौड़ते हैं, fight against cancer, चलो दौड़ते हैं, let's run together, चलो दौड़ते हैं.
Detect early, treat timely, eradicate totally. A global cancer awareness drive by Grace Cancer Foundation.
You gotta hit cancer, a big blow. It's time to wipe off this foe. Let's run now and show. Let's get set and go. जिस तूफान का डर है हर दिल में, उस कैंसर को जड़ से मिटा दे हम मिलके, चलो लड़ते हैं, चलो पढ़ते हैं, चलो दौड़ते हैं, let's run together, चलो दौड़.
This program starts in 3 minutes.
Cancer, चलो दौड़ते हैं, let's run together, चलो दौड़ते हैं, कैंसर को रोके, खुशहाली फैलाए, एक उम्मीद फिर से हर दिल में जगाए, चलो लड़ते हैं, चलो पढ़ते हैं, चलो दौड़ते हैं, let's run together, चलो दौड़ते हैं, fight against cancer, चलो दौड़ते हैं, let's run together, चलो दौड़ते हैं.
This program starts in 2 minutes.
Detect early, treat timely, eradicate totally. A global cancer awareness drive by Grace Cancer Foundation.
You gotta hit cancer, a big blow. It's time to wipe off this foe. Let's run now and show. Let's get set and go. जिस तूफान का डर है हर दिल में, उस कैंसर को जड़ से मिटा दे हम मिलके, चलो लड़ते हैं, चलो पढ़ते हैं, चलो दौड़ते हैं, let's run together, चलो दौड़ते हैं, fight against cancer, चलो दौड़ते.
This program starts in 1 minute.
Together, चलो दौड़ते हैं, कैंसर को रोके, खुशहाली फैलाए, एक उम्मीद फिर से हर दिल में जगाए, चलो लड़ते हैं, चलो पढ़ते हैं, चलो दौड़ते हैं, together, चलो दौड़ते हैं.
This program starts now.
Good evening and good morning to all our viewers across the globe. Thank you so much for joining us in this wonderful initiative of taking the awareness and prevention of cancer across the world. Once again, a warm welcome to each one of you. Thank you so much for being part of this wonderful movement across the world. I represent Grace Cancer Foundation. Grace stands for Global Research and Cancer Education. So the singular vision of this organization is to alleviate the cancer burden across the world. We emphasize on prevention of cancer, and also we focus on early detection of cancer through mobile cancer screening initiatives. So the campaign has started about 6 years back, and now this has been catapulted into a pink revolution across the world with multiple ambassadors, crusaders joining for this cause. And we're so happy to announce that this year we'll be having the third edition of Grace Cancer Run as well on 10/10/2020. So this is, remember the date, it's very easy to remember. The global virtual Grace Cancer Run is going to be held on 10/10/2020. It's on a Saturday morning. This will be held at multiple locations across the world. The singular aim of this run is to create awareness about cancer and to emphasize on prevention of cancer. One simple means of preventing cancer is to have an active physical life or a healthy lifestyle. So we are promoting active physical life as a means to prevent not only cancer, but other non-communicable diseases like diabetes, hypertension, cardiac diseases. So with that intention, the event is going to be held on 10th of October. Please join us in this moment. And today, I'm glad to announce you that the first webinar as a precursor, as a curtain raiser for this mega event is going to be held now. This is mainly focusing on alleviating the myths of cancer. So we're looking at debunking the myths of cancer. So today's topic is all about the different myths that are around. And people still believe that cancer cannot be cured. Cancer, there is no treatment. So much of misconceptions are around. So we are here. Expert panel is available for us. Today with me, I have a wonderful team. Dr. Hemant Udayaraju, who would be moderating the panel discussion. He is a consultant robotic surgical oncologist working at Apollo Hospitals. So he's a good Paul and a friend and a partner with me and a part of the foundation as well. So welcome, Dr. Hemant. Thank you for joining us.
Hi, China.
I also have with me Dr. Vamshi Krishna, a senior medical oncologist practicing at Apollo Hospitals. And really glad to have you, Dr. Vamshi, here.
Glad to be here.
And I also have Dr. Pratima Kanamuri, who is an oncoplastic breast surgeon. And really glad to have Dr. Pratima in our midst. And we look forward to hear from you. And we want to hear what are the common myths that are around and how we can really kind of address them. So thank you for joining us, Dr. Pratima.
Hi, China. Hi, Dr.
Hi. So with that, I think we will straight away get into this topic for the day, that is debunking the myths of cancer. So I would request Dr. Pratima to take us through a small presentation on various common myths that are available, and then Dr. Hemant would take over to lead us into the discussion, and then we will be able to answer all the questions that the viewers may be having. Over to you, Dr. Pratima.
Hello, everyone. Thank you so much for having me here. It's my pleasure to be here with you today. Today, we'd like to talk about cancer myths. As we all are aware, unfortunately, the incidence of cancer as well as deaths from cancer has been exponentially growing over the last few years. And yes, I think in India especially, the rates have been going up. And I think we have made tremendous progress in our awareness programs. And also generally the amount of investment that's made into increasing screening facilities and other things. But some of a few things that are really preventing us from moving forward are cancer myths that exist. And this is what we're going to talk about today. And I'm going to go through a few of them. This is not moving forward. Okay. Yeah. So the first most important misconception is cancer is fatal. People have this very negative view on cancer, thinking that once a cancer diagnosis is made, that's the end, but which is completely not true. We have made tremendous advances in our ability to diagnose cancer at an early stage by awareness, by increasing our diagnostic modalities that are available, and also the research that has gone into the treatments available. Almost a third of them are completely curable. a third of them are able to live a life even after diagnosis of cancer. And yes, we do lose some, and we're still working very hard to decrease these numbers. Next thing that is commonly talked about, cancer absolutely cannot be prevented. If you're meant to have it, you're going to have it. That is absolutely not true. And this is what Dr. Chinnababu was talking about. Yes, staying active, avoiding a sedentary lifestyle, eating healthy, and maintaining an ideal body weight, avoiding alcohol. And the first most common thing, I mean, the largest risk factor for a lot of cancers is smoking. So avoiding smoking, and all these things will increase your ability to prevent cancer. Another thing which I see in most of my patients, they're like, I'm sorry about that. A lot of times people have this idea, and I see this a lot in my patients, where they're like, I did everything I could, I did everything right, how come I still have cancer? And this is a very common, but the understanding is, yes, we can do everything, and yes, in spite of our best efforts, some percentage of people might still have cancer, but still you should try to have an early diagnosis, and this is treatable. So it's good to have a positive attitude about it. If you have it, there are treatments out there and you can be cured. A common thing is cancer is contagious. That is absolutely, it's a non-communicable disease. Yes, there are certain infectious diseases like hepatitis B and cervical cancer that is transmitted through the human papilloma virus. Otherwise, these cancers are not really contagious. The next thing is the cancer history in my family. There are some people saying there's no cancer history in my family, so the chances of me getting cancer are very low, which is not true. Only 5 to 10% happen due to hereditary reasons. 90% of cancers happen on their own. So I think just because there's no history of cancer, that doesn't mean we cannot be affected. So we should try to take all the preventions necessary, and also get appropriate screening, which is recommended for your age group. And the other thing is, just because there is a family history of cancer, that doesn't mean you will definitely get it. Only 25, depending on the type of gene that is involved, about 50% or 25% of the family members, your chance of getting it is about 25 to 50%, depending on the type of gene it is. And for this, genetic testing will be important to decipher that. Misconceptions about tobacco. So tobacco, some people who are smokers are like, oh, from pollution, you have a greater chance of dying than tobacco. That is absolutely not true. Yes, pollution does increase your risk for cancer, but tobacco is the #1 cause of lung cancer. The other thing is, people are like, oh, I don't smoke, so I shouldn't have lung cancer. That is also not true. People can still have lung cancer. And also, secondhand smoking can cause lung cancer. Some chronic diseases might increase your chances of having cancer. And also, some people think like, oh, I just smoke Marlboro Lights, so maybe the amount of tobacco shouldn't, that should be a preventative thing. Absolutely not. Your risk is the same. And just because you stop smoking, if you smoked for a long time and you just stop smoking, it doesn't mean that it will, your risk goes back to zero. It will go down, but not completely. And over time, it can decrease. So cell phones, microwaves, and vaccines, people have different misconceptions that they could be a cause for cancer. And there's no proven evidence or clear evidence that this is the case. So there's been a lot of hype about alkaline foods, superfoods, green tea, preventing and curing cancer. And I've also had some patients saying, can I just I have a cancer diagnosis, but if I do this, can I avoid other treatments? Will I get better? The truth is, yes, it is always good to eat healthy, and these have antioxidant properties that will help, but definitely they will not prevent or cure cancer completely. The other big thing that our patients ask us, if I eat sugar, will that increase will that feed the cancer? See, the thing is, sugar has not been shown to have a direct effect on cancer cells, but definitely if somebody eats a lot of sugar, that will be converted to fat. If you gain weight, and obesity and a high body weight can increase your risk of cancer. So there are times when patients do not believe in chemotherapy and radiation therapy and other newer therapies, and they believe that a positive attitude, homeopathy, naturopathy can cure cancer. So this can be a misconception, especially aggressive cancers sometimes don't respond to therapies that work very slowly. So these have not proven to really help. So definitely, I think getting aggressive treatment is important depending on the type of cancer. A lot of people believe there's a lot of controversy about mammography, that mammography increases breast cancer risk. Yes, definitely radiation has some risk, but if you do it, if you use it judicially, like after 40, and only like once a year, I mean, or you do it once a year or once in 2 years after 55, the risk is very minimal and the benefit is great enough that it's worth the little bit of risk. It's the radiation that you would get without anything, without just by living for over 6 weeks is what the radiation you get from a single mammogram. There is some misconception that using bras or deodorants can increase your breast cancer risk. That is absolutely not the case. Uh, and another thing, that men don't get breast cancer. Men also have breast tissue. It is rudimentary, but it is there. And definitely 1 out of 100 cases breast cancers are in men. And another major thing that we, especially in India, women believe, or families believe, that, okay, if I have breast cancer, if I remove the entire breast, the chance of me surviving is greater. That is absolutely not true. Yes, there's certain oncological factors that might determine it, but more surgery doesn't mean better results. Young women don't, especially in India, they don't go for routine gynecological checkups. It's not a part of their thing, and they believe that I'm young, I will not get cervical cancer. That is not true. People having multiple getting married early, having children early, multiparous women with multiple partners can be at risk of cervical cancer, and this is a preventable cancer, so you should absolutely be on top of that. After 21 years of age, when you're sexually active, you should go for your screening once in every 3 years for a pap test, and if you get your HPV test, then you can do it once in 5 years. You cannot have cervical cancer after hysterectomy is a misconception, because there are some cancers that there are certain types of hysterectomy where we spare the cervix. In those situations, you still might need a pap smear. And also, if you had a history of cervical cancer, then you can also have changes in the vault of your vagina that can also has to be screened. If you have a single sexual partner, some people believe that you might not have cancer, but you don't know if your partner has been infected before, or if he might have, or he or she might have partners. So you absolutely have to you should still continue to have. And even delivery, when you're having a delivery also, you can sometimes contract HPV. I will not, the other misconception is, if I use some kind of a barrier method during sexual intercourse, that will avoid cervical cancer. Not necessarily. It's definitely helpful, but you can still have contact and it can spread from the surrounding areas. So you should definitely go for your pap smear regularly. A very common question by most people, doctor, I do not want to have a biopsy because I'm afraid that the cells will track down and then will disrupt the cancer cells, the tumor, and then it's going to spread to other parts of the body. So this is something that is not true. Biopsy is very necessary. Nowadays, biopsy is key. Surgery is not the answer, because we have a lot of tests we can do ahead of time, which will help us treat you appropriately. And also sometimes we want to give some therapies before surgery. So all of this is very important. So getting a biopsy and getting the appropriate tests with your doctor is very important before cancer treatment starts. There's a lot of negativity about chemotherapy, that it's poisonous, it worsens your cancer, and it can really kill a patient. Yes, it is true. In the past, chemotherapy was very harsh, but now we have done tremendous strides in trying to understand and really target therapies to the cancer cells, also decrease these side effects, and really prevent a lot of these side effects. And also personalized oncology has also improved the outcomes. So definitely, yes, they can be poisonous, but they can be has some side effects, but they're not something that cannot be managed. Radiation therapy, everybody has a very negative attitude. A lot of people go for more surgery thinking they want to avoid radiation. So surgery does very different things, and radiation handles very different things. It handles the microscopic disease, which cannot be addressed by surgery. So it is a very important component of treatment. Yes, when we give radiation, we make sure we don't go cross the dose above. We don't cross the dose that is considered harmful. So usually for standard treatments, we do not. It doesn't cause cancers. And so in India especially, people have a tendency to say there's there are a lot of ill fate has caused this, and they have a negative attitude, and they feel that they need to be punished. This is a poor attitude and should not prevent you from getting treatment. So another thing is, I get this question very often. If a patient is going through radiation, they're worried that the radiation will affect the people around them. That is not the case. That the radiation treatment is 1 to 2 minutes, and you're not transmitting the radiation to people around you. So definitely, it is safe to live with patients undergoing treatment. One of the major issues in our culture is the social taboos and that are associated with, especially with women-related cancers. Because if you have a cancer in the family or a genetic mutation, people are afraid to get this tested because it might prevent their ability to get married, or the family might get shunned. So there's a lot of problems. And I've had so many women just say that, you know what, they never sought treatment because they feel like somebody will kind of discriminate them based on that. And I think one of the major issues that we're dealing right now, and me and my colleagues have struggled with this, the people are afraid that, they might die from corona, and they're avoiding care for cancer care. And this is a mistake. Yes, if corona was going to last for a month or two, that's different. But now corona is here to stay with us. And hopefully with the vaccination, the next couple of years, things might get better. But cancer can kill you depending if it's an aggressive cancer. So you absolutely should be safe, but also get treatment in a timely fashion if you have cancer.
Pretty comprehensive, Dr. Pratima. You made my job very simple. I don't think there's any aspect which you have left uncovered. I think the entire thing is almost done, except that you've gone at a very rapid pace.
I'm sorry, was it too fast?
No, I mean that's how it's meant to be. In the sense you have initiated it, so we'll take up specific queries in the time that we have. So let me go ahead with a few questions. There's one question which says that I don't smoke at all. So won't I ever suffer from lung cancer? Am I protected from lung cancer? Dr. Vamshi, would you like to take that?
So the fact is, people who smoke have a much higher incidence of developing cancer. Let me put it this way. We have 100 people who smoke a lot, at least 30 to 40 of them will develop cancer. If you have 100 people who don't smoke, unfortunately, 4 or 5 of them could still develop cancer. Now, the number is so much lesser that you definitely should avoid smoking. It's like driving on a two-wheeler without a helmet, without holding your hands on the bars. Some of you will survive, but the majority will die. That's the analogy that I can give you. So that's how it is.
So the person who smokes is someone who's taking on a lorry head-on, is it? Something like that?
Absolutely. The lorry head-on and the driving on the wrong side without a helmet and deciding to talk on the mobile phone at the same time.
Yeah, yeah, I think this question Chinna would love to take. I have a cell phone tower near my house on my apartment. Is it safe for me, or should I get it removed?
I think this is a very common question, and many people cell tower radiation. But if you look at the emission of radiation from cell towers, or for that matter from mobile phones, I think this is a low frequency electromagnetic waves that we are looking at. So the people have got this fear because after the Chernobyl, after all the atomic bombing, whatever the radiation has come, because of that, people have a negative connotation with respect to radiation and cancer. So this is a very low frequency radiation. So various studies have been done. There is no conclusive evidence to say that the cell tower radiation would lead to cancer. And I would rather say if you're staying very close to a cell tower, you are more protected because the radiation from cell tower would travel parallelly, and the person who is very close to more than 6 meters away is more safe actually. So in that sense, I would rather say if you have a poor signals and if you are staying very much away from the network and you're talking too much on a cell phone, the exposure is much, much higher with a cell phone, the poor signals than staying close to a cell tower.
This is an interesting question. I leave it open to all three of you. Positive thinking will cure cancer. Dr. Pratima, Dr. Chinna, and Dr. Vamshi.
So with any situation in life, yes, positive thinking is a must, and it makes our life and people around us do better. Yes, positive attitude is important, but that alone is not enough to cure cancer.
Positive thing is important. You should be positive in all adversity. However, as Dr. Pratima says, it will not cure cancer. Certainly, it will give you a different perspective on how to manage your cancer. It will help you tackle the cancer in a much more better way. But cure, unfortunately, at this point, we would not say that is true.
No, certainly, I think fear is the biggest killer. So in that sense, staying away from the fear and with courage, being positive, I think the psychological mindset itself would definitely contribute, though we cannot say that positive thinking will cure the disease, but that will definitely add to, for the overall, the way they run through and cope with the disease. I think for that, definitely there's a benefit, and people with a positive attitude have fared reasonably well.
So if I may add, there is no evidence as on today that positive thinking really cures cancer. So it's not a part of your evidence-based guideline. But yes, if you look at the cancer therapies, which include surgery, radiation, chemotherapy, it's pretty prolonged. And there is always a chance that the patient or his family gets demotivated somewhere in between. So definitely positive attitude will help you complete the entire treatment process, probably including the family also into a part of it, makes the treatment process, I won't say it will reduce the complications, but it will make the acceptance of treatment, the result and the complications probably a little bit more easier. So yes, positive attitude does really help, but just positive attitude alone won't cure your cancer. And there is another question here. If no one in your family has had cancer, you will not get cancer.
I think I will take that question.
Yeah, go ahead, please.
Yeah. I think family history or the hereditary cancer rates are less than 5 to 10% overall if you look at. So majority of them are sporadic. So 90% can say are sporadic. So family history per se is not a way in which you can say whether you have risk. It all depends on the lifestyle. If I have to put cancer as one disease, it's a lifestyle disease. So if you have the risk factors, definitely you are at the risk. So family history per se doesn't rule out, because the hereditary cancer risk is less than 10% overall if you look at the number of cases. Dr. Vamshi, you want to add anything?
Absolutely. So the idea that, see, the whole genesis of cancer cells is some cells going bad. Now, these cells can go bad for a variety of reasons, which we do not know right now. Heredity is just one of them. I would put it this the other way around. If your family, someone has cancer, you have a slightly higher risk, but the opposite is not true, unfortunately, but that's what it is.
And I'd like to add one more thing, and this is something that we struggle with in our working environment, where a lot of people have this taboo of checking for having genetic testing. So if there is evidence that you have a genetic mutation in your place, doesn't mean that every person will have cancer. There is, depending if it is a dominant transmission, we call it 50%. There's a 50% chance that you might have that cancer if your father or mother have that particular gene. This is for hereditary cancers that we're talking about. So, it is important to know that, because then you can screen yourself more regularly, or maybe take some prophylactic measures to prevent a death death from cancer. So I think the taboos that we have in our social system really prevents people from moving forward. That is really something that we want to improve over the coming years, that there is nothing to hide about this, and it is just being proactive to live a healthy life.
So there's a question here. Bharani asks that if we are doing mammography every 1 year, is there an increased risk of cancer? Dr. Pratima has answered it already. I think you can take it up in a detailed way.
Yeah.
So does doing a mammogram every year increase risk of cancer?
So there's been a lot of studies, and this is a very, very controversial topic, and the Westerners believe it's in a very different way, and US has a very different approach on it, and then the NHS, that is UK, has a very different approach on it. But basically what we know for sure, we do not want to do routine screening before 40, because yes, mammography doesn't really help us in those patients because their breasts are very dense. But after 40, you're able to pick up cancers. And if you really do it once a year till you're 55, and once in 2 years after that, if you and study, the risk and the benefit ratio, really, the benefit is more than the risk. So after, and I know a lot of people will contradict me on this. I'm sure everybody has different approaches, but this is what is recommended, because at 40 to 55, people tend to get more aggressive cancers. That the goal is, if you actually do mammography more frequently, you can catch these aggressive cancers and really make a difference. And after 55, usually once in 2 years should suffice. And this doesn't increase it to your risk exponentially.
Yeah. So another question here, I would like surgeon's perspective, and then since we don't have a radiation oncologist, I think Vamshi would answer on medical onco and radiation onco. Cancer treatment is always very painful. Chinna?
Certainly, I think there is some truth to what it has been said, because cancer treatment depends upon the stage. Early treatment, many times you can get away with a single modality treatment. Especially for solid tumors, you can do surgery. Nowadays we are doing the organ preserving surgeries. As Dr. Pratima mentioned, we don't have to remove the entire breast, we don't have to remove the entire throat. So we can do an organ preserving, quality of life improving kind of a surgeries these days, so it is not painful. So it depends upon the stage. If you are in stage 3, stage 4, you require multi-modality treatment. So you require surgery, chemo, radiation, all combined. So in a sense, the key here is, if possible, prevent. If not, catch it early. So early detection is the key to make it less painful. So that is the message I think we are really trying to give through this webinar, that we need to create awareness and detect the disease very early. So that is the point, key message that I want to give to him.
Yeah, Dr. Vamshi?
So again, there are probably two parts to my answer. The first part is, not all treatments are as painful as patients expect. And in fact, we have patients walking in and saying, oh, we thought it would be much worse than this. So that is something to note. Remember that a lot of the problems which patients face, especially in the last stages of the cancer when they are taking multiple therapies, is because of the cancer itself. It's not because of treatment. The patient's cancer itself has unfortunately gone into so much parts of the body that it causes pain. However, there are very good pain medications available. Now, the biggest challenge what I face is, sometimes patients feel embarrassed to tell us. They don't tell us openly. There are enough medicines available. There are enough procedures we can do to make sure that we can control the pain. Then, second thing, even the chemotherapy side effects have reduced to a large extent because of newer medicines and frequent consultations. So we are a phone call away. We tell the patient, look, you have a problem, tell us, I'll tell you a medicine for it. Do not wait for 5 days with the problem before approaching a doctor. The last part of it is regarding the newer treatments that have come around, which are known as targeted therapies. Now, in approximately 10 to 20% of patients, I won't say 100%, but around 10 to 20% of patients, we have drugs which are given orally, no IV admissions, no need for injections, and they work much better with much lesser side effects. So an example of lung cancer, wherein people who have a type of mutation known as an ALK mutation, we have people living for more than 3-4 years on an oral medicine. No chemotherapy, this is stage 4 we are talking about. So there are advances, and while it is a huge problem, of course, There's a lot of other issues like psychological issues and social issues attached rather than plain pain. And that is something which should not preclude a patient from getting treatment. Have an honest conversation with your oncologist, and there are things which can be done to reduce the pain significantly.
Dr. Pratima,
Yes.
do you like to add something to this?
I think the only thing I want to add to this is also depending on the type of cancer that you get. So, for example, if somebody has breast cancer, usually the pain associated with breast cancer surgery is not as bad as somebody who has pancreatic cancer or liver cancer. So, I think it also depends on the type of cancer, and also Dr. Chinna said it is also it is the stage of cancer and also the modality. For example, a laparoscopic colon resection is less painful than somebody who is having a complete open surgery, and the recovery is much faster. Studies have proven this over and over again. And so the robotic surgery, there is a precision that is involved with it that also decreases your pain. So definitely, I think it depends on the type of cancer. It depends on the stage of cancer. It depends on the type of chemotherapy regimen that needs to be used. But the most important thing I want the viewers to go back with is cancer care has become very sophisticated now. It's not like before where you just everybody gets these intense drugs and it's the same medicine for everybody. It's not such. The research has really got us to a point where we're really tailoring treatment based on the patient, their particular cancer. It's very personalized medicine where we really put a lot of thought into how can we minimize the amount of side effects and really increase the benefit to the maximum extent. So that is the kind of thought that is put in, and it is not as simple anymore, like how it used to be. And that's why patients are doing much better and they're able to tolerate treatments better.
Okay, so if I can summarize, if you look at surgery, a lot has changed. You have minimal access surgery. You don't use big incisions anymore. You have rapid recovery time with robotic surgery and keyhole surgery like laparoscopy and VATS. Second thing is organ preservation. You don't remove big organs anymore. Only the part of the disease is addressed if it is early disease. When it comes to chemotherapy, a lot has changed. In fact, everything has changed. The drugs have changed. You have newer therapies, targeted therapies. The medicines we use and the way it is given, the access, the venous access, everything has changed. So definitely the pain factor has come down. Same with radiation, where you have the newer radiation oncology treatment modalities, image guided and so many other things in which the side effect profile is much, much better. So yeah, there are a few more questions. I think we'll try to take as many as possible in the next 10-15 minutes. Will physical exercises like running or walking help cancer patients in the initial stage? Brief answer. Dr. Chinna, would you like to take it? You have to unmute. Yeah.
Sorry. Yeah. Physical activity, once the disease has come, it would not help in the prevention of it because the disease already occurred. So we are looking at preventive side. But for people who are physically active, they feel good, they tolerate the treatment well, and especially in early stage, potential cure is really possible. So even for early stage, the people with the disease as well, having a physical activity certainly help them to cope up well and to kind of get to the treatment very well.
I would like to add one more thing to what he said. He's absolutely right. Yes, if you're currently going through the treatment, it doesn't. But once somebody has finished their treatment and we're worried and we're following these patients for a recurrence, yes, studies have shown that maintaining, being active and maintaining an ideal body weight does decrease your chance of a recurrence.
Yeah. So the summary is this has a preventive role before the disease comes in. So if you look, if I can give an analogy, it's like planting a seed. You can't plant a seed and expect the fruit after you get the disease in that time frame. So your physical activity, herbal products, your positive attitude, and all those things have a role over a long period of time, which help in probably preventing the disease from occurring. But once the disease occurs, these things only have a very minimal supportive role and they don't have any great curative role, right? There's another question from Maruti. He says liver and pancreatic cancer is hidden. Dr. Vamshi, would you like to take it?
It's hidden. That's what he's asking.
Hidden. Yeah, partly right. Yes.
Right. So see, this is a very simplification of what is it is. The reason I think he's asking this question is because these cancers are generally not associated with a symptom until they become more advanced. Now, unfortunately, that is because of the nature of the organ. The liver is a large organ, and a small cancer growing there will go unnoticed. This is because of the greatness of the human body, that it is able to absorb some damage while still continuing to function. So, unfortunately, yes, a lot of patients do end up coming at a later stage. However, going back to what we were discussing about screening, if especially those patients at high risk, say a hepatitis positive patient, gets a regular screening done, is more regular in following it with an ultrasound, and then they get a detected cancer early, they're able to be cured even at that stage. So the importance is knowing what you have and then screening for it. Regarding pancreatic, unfortunately, even in the Western countries which have screening programs, which have regular follow-ups, 50 to 60% of patients present in a stage 4 or an advanced disease. So for me, I think the advice to all the people would be, do not take health checkups as something as wasted. We have often had patients who come and say, oh, we got tested, but nothing was done. It's a waste of money. The idea is you may end up not detecting anything. That's good for you. That is not bad. You're not doing something to detect just that. If you get an answer saying you're healthy, be happy about that. Do not stop doing testing just because you're getting normal results.
Yeah. So on the same note, there's another question which says that the basic symptoms of any cancer in the initial stage.
So again, that's a very broad question and cannot be answered. Unfortunately, cancers are very different. What is important to note is, at least in the areas where we can see, say the oral cavity, mouth, if you feel any abnormality, a persistent ulcer, persistent hardness, something which is out of kilter and cannot be explained, please get yourself checked up for it. Again, you may end up being told that it is nothing and there is fine. That's good. But do not hesitate to get checked up. The general idea I would give is, if you have any symptom for more than 7 to 10 days, which is persistent, which is increasing, these are two important characteristics: persistent, unexplained, increasing. These 2-3 things should prompt you to check for any cancer.
Can I add, Dr. Hemant?
Yes, please, please.
Yeah, just for a simple mnemonic called a caution. C stands for change in bowel and bladder habits. As Dr. Vamshi mentioned, any symptom like constipation, blood in the stool for more than 2 weeks, yeah, that has to be reported. So change in bowel and habits. C. A stands for a sore which does not heal. U stands for unusual bleeding or discharge from anywhere in the body. T stands for thickening or lump in the body which has recently appeared and increasing in size. Any lump in the breast need not be scared of, especially young women do have lumps, majority of them are benign. But any recent onset of a lump which is increasing in size, you have noticed, better to get checked. So then I stands for indigestion or difficulty in swallowing. O stands for an obvious change in the birth mole. And N stands for a nagging cough, which lasts for more than 2 to 3 weeks. So this is caution in general, a common symptom that I mentioned. But as Dr. Vamshi mentioned, any symptom which is unusual, which has occurred, which is lasting for more than 2 weeks, needs to be investigated further.
Right. A seemingly non-troublesome event which is going on for a certain amount of time definitely merits evaluation so that we can pick up something in an early stage. Yeah. So there's another question which actually Dr. Pratima started with: is cancer contagious?
Yeah, so like we said, cancer is not contagious. It's considered a non-communicable disease. But like we discussed, there's certain infectious diseases like hepatitis B. A person who's chronically infected with hepatitis B, hepatitis C, they can have an increased risk of liver cancer. And once you get liver cancer, the cancer itself is not, but yes, hepatitis B is contagious, that but not the cancer itself. Same thing with one of the preventable cancers we talk about in India is a cervical cancer, which we're really working. The numbers are coming down. This can be prevented by, and this is also due to the HPV virus, which is passed on from one person to the other. But once you get cervical cancer itself is not communicable. So cancer is not contagious.
Yes.
Dr. Hemant, if cancer was contagious, we both would not be here.
Yeah, very true. Very true. Any questions more coming on FB?
One more thing, I'm sorry, if there's a question.
Please go on.
So there is some notion that if we have some injuries, it can lead to cancer. That is something that comes up, and which is not true. But also, if somebody has, a very severe burn that, that is a scar from for a long time, sometimes they have a non-healing ulcer or something like that. So if something like that shows up, and that is something to consider, because long-standing scars, long-standing, burn scars can cause squamous cell cancer. So that can happen, but mostly injuries and burns don't cause cancer. I think that is something also to people to be aware of. Yeah.
So,
Yeah.
Dr. Heyman, just to add to this, one more common misconception patients have is as soon as you have cancer, your diet has to change completely. You have to be isolated. You should not mingle with people. You have to have special super diets. Nothing. There is no special diet which you need. And what we advise to patients is just continue eating whatever you're eating, whatever you like eating. These are not there are no foodstuffs that will increase cancer. There are no foodstuffs that will make cancer disappear. Yes, you should have a balanced diet. Yes, it's important to get all nutrients and minerals, but there are no superfoods for this. So that's something which I think all people should be aware of. There are no magical vitamin B17 or B28 or some other weird numbers, which unfortunately internet is
Yeah,
propagating.
they're in WhatsApp only.
Yes.
Yeah, so there are no magic bullets, there are no shortcuts. And yeah, so one last question, one quick line from each of you is that we cannot participate in normal life activities and jobs after treatment for cancer, after getting treated for cancer. So we're running out of time, so we will just take this one last question.
Absolutely. What we really tell our patients is you want to stay as normal as possible, because that is one of the things that keeps you positive and keeps you more hopeful. Yes, there are certain treatments that kind of, put a break to this. For example, you're just recovering from surgery, or right after chemotherapy 1 week, you might be very tired. And radiation also can make you a little tired. You have to take rest when you're a little tired, but the minute your energy comes back, you have to start living your life as normal as possible, taking the precautions necessary. That is what is going to help you get better more quickly, stay positive, and stay connected to the world around you, and prevent depression.
Dr. Vamshi?
So the idea, what I tell all my patients is, the last day of the chemotherapy, I tell them, look, you go, you're free, you go live normally. There is absolutely nothing that you should not live normally. And in fact, after 6 months, what the patients themselves say is, oh, we look normal, and nobody even knows that we are cancer patients. So I think that is very important. And it is important to realize that you have survived it and you are a winner. It is not that there's no stigma attached to having it. It is something that you have conquered. So in fact, the people who have survived cancer, who have won over cancer, they are great victors. And they should celebrate that by living as normally, if not more normally than the other people.
Yeah, so there's still a lot of questions coming on. So I will take it and I'll close it. So since we are running out of time, does Rangoli or holy colors cause cancer? So there is an entire list of products which are suspect for causing cancer, but there is no proof, right? So I don't think Rangoli or holy or hair dyes or antiperspirants or artificial sweeteners or colors or food additives, there is no proof as on today that any of these go on to cause cancer. But yes, they're all chemicals. We understand that they have their own problems. So definitely you need to be careful when you use those things. But I don't think a holy color or a Rangoli which will definitely cause a cancer. So Dr. Chinna, we are running out of time.
One last thing, Dr. Hemant, I just want you to add a few lines about the whole corona and not getting cancer treatment. Just one line about that before we close, because it's the need of the hour.
Yeah, so I will let Dr. Chinna do it because we are almost short of time. Any more questions? Okay, please keep posting them on FB. We will answer them. We will take those questions on FB and answer them on that platform. Dr. Chinna, cancer and COVID and the closing note.
Sure. Thank you much, Dr. Hemant. And I thank all analysts for your time and your valuable inputs. So one thing that I need to talk at this point is, as Dr. Pratima said, COVID is here to stay for some time. But in the times of COVID, cancer cannot be ignored. What we have seen in the last 4 to 5 months is The presentation of cancer is much more delayed, later stages, because people have the fear of going to hospital. They have the fear of getting COVID in the hospital. That's the reason they neglect their symptoms and they don't seek medical attention. So in the context of COVID, cancer can be ignored. So that's the reason we are coming up with the run, which is a virtual you can do at your home, on your treadmill, on your terrace, in your backyard, wherever, on 10th October. That's when we are going to declare with a theme that beat cancer beyond COVID. So together we can beat cancer and COVID. So with social distancing, with all the norms that you need to take care, you can still be physically active at your home. You know, you virtually can still participate in this run. So at this point of time, once again, I thank each of the viewers here, and we are open to you. Anytime you have a queries, you can always post in our FB page. We will revert back to you. And thank you so much for viewing and watching us. And I look forward to see you all and register at gracecancerrun.com for this upcoming event on 10th October, 10/10/2020. Thank you so much for watching. And I would request Dr. Hemant to close.
Yeah, thanks everyone. Thanks Dr. Vamshi, Dr. Pratima, Dr. Chinna. It's been great. My role has been the easiest here. You guys have done most of the work. It's been good. It's been a nice interaction, and I hope each of all of us here will put our foot out on 10/10, 10/10/20, and then and encourage each and every one of our family members and our immediate circle to basically step out, adopt an active lifestyle. Maintenance of an appropriate body weight for age is one of the determinants of long-term disease. Most of the non-communicable diseases are seen in patients or in people who have not maintained an appropriate body weight for their age. So a physical activity like running, or walking, or skipping, or whatever you can to stay fit will help you, take you a long way in maintaining your health and maintaining your family's health as well. On this note, see you all next week. This is a series of webinars that we are doing as curtain raiser for the main event. So see you same time, 7 p.m. on the next weekend, next Sunday. Bye everyone. Take care. Stay fit.